Hello everyone, this is Nurse Annie again and welcome back again to my channel. And of course, to those of you who are new, thank you for tuning in. And if you haven't yet, please do hit that subscribe button and let's connect. So, have you ever felt so overwhelmed at work that you cannot just do all the tasks that you are planning to do in a 12-hour shift? I don't know about you, but for me, I still experience this once in a while. Times when I just feel so overwhelmed with all the things I have to do. And for the new nurses out there, just being new gives us so much anxiety, right? Perhaps you walk into your unit and take the handover from outgoing nurse, and subconsciously you're already planning your day. But as the shift goes, events happen and now you're just feeling so overwhelmed with all the unexpected events of the shift, and now you're all behind. So then your time managing skills come into play. So today in this video, I will be sharing with you some tips on how you can improve your time management skills so you can get all your work done on this 12-hour shift and go home on time. Who wouldn't want to go home as early as possible and have more time with your family or for other things in life, right? So if you are interested on this topic, then keep on watching. So time management is very important in our kind of work, especially nowadays that lack of staff and extra workloads are very common. We really have to master our time management skills in order for us to go about our work routine smoothly and efficiently. And perhaps if after a few months or years or so in your job and you still struggle with managing your time, and perhaps that would be the time when you will sit down and reassess yourself. What could have you been doing wrong, or what are the things you can improve? And perhaps you can also ask your colleague or your mentor or a buddy at work and tell them what you feel. And perhaps they can help you figure out what are the things you can improve and how you can actually do it better. Okay, so but before diving into the tips, I just want to quickly tell you what are the signs or what are the things you can observe on yourself that signals that you have a problem managing your time. So have you ever felt like 12-hour shift is not just enough to get all things done, and you just feel so overwhelmed that it's like you just want to get all your things and leave? Do you often forget to complete tasks for your shift? Do you always feel like you have to rush at the end of your shift just to complete the tasks that you have to do? Do you always need help on your 12-hour shift? Do you always feel like you can't even get a break to pee or to eat or just breathe somehow? Do you always clock out late? If this is you, then perhaps you just have to reassess yourself and perhaps improve on your time management skills. Okay, so let's get on to the tips. And my tip number 1 is always arrive early to work. This perhaps is one of the most important time management tips I can tell you. Arriving to work early is just like setting your day off right. You can prepare yourself physically, emotionally, and even spiritually on the 12-hour shift that is ahead of you. And you can also use this time to just quickly go over your patient's chart and just have some overview about your patients, which can actually give you some time to just mentally prepare yourself for the day. My number 2 tip is prioritize. Prioritization is a must skill for us nurses. We are always confronted with multiple tasks in a shift, and even we have all things planned out, patient's condition can change in a heartbeat. And when prioritizing, we should always remember to keep patient safety first. And when deciding which tasks to be done first, we always have to keep in mind time-sensitive activities as well. For instance, you have 3 patients. Patient in room number 1 is screaming for pain medication, and the pain score of that patient is 10 over 10, and your patient in room number 2 has an IV continuous infusion which needs a new bag, and your patient in room number 3 just arrived, that is your admission. So which patients should you prioritize first? Okay, so of course, give your pain medication to room number 1. That is your priority. And for room number 2, you can just go turn off that IV pump and just go later to hang that IV bag. Or you can even ask for a colleague to hang that IV bag for you, right? So after giving that pain medicine, you can just go hang that IV bag if not done so by another nurse and just go on with your admission in room number 3. Okay, so tip number 3 is keep notes of your tasks. Writing things down help you keep track of your day. We oftentimes just organize our tasks mentally, right? But we oftentimes forget. So just to ensure that we don't miss anything, then better write things down. This may include time of medications. For me, I usually write down my scheduled medications just so I won't forget anything. So if I finished giving them, I just cross it out and then go on with the next. So you can also do that or any other tasks that you have to do in the shift, like change of dressings or change of IV lines especially. And of course, some procedures that the patient has to go, and any doctor's orders that you have to do. Okay, so number 4 tip is delegation. We nurses have to learn how to delegate. Personally, I'm not good in this. Believe me, I always want to do things myself. Well, it's because I feel that I can finish tasks, faster, and I can do so much more if I do it on my own. But if you yourself think that you cannot do things on your own or you cannot complete tasks on time, then you have to learn to delegate. For sure, your CNAs cannot give that pain medication for you or hang that IV bag for you, but surely they can attend to that admission first by situating them to the bed, taking the vital signs, taking their height and weight and all those stuff while you do the other things. So with delegation, you sure can manage your time better. Okay, so 5th is anticipate events. This specific skill to anticipate what can make your work easier could be learned as you gain experience. Of course, as you learn the basic routines and skills, you will learn to know what are the things you needed or what could go wrong before it will. Just for example, if you are starting an IV line, you will anticipate that you might not be able to get that IV in one shot. So you might as well bring more IV cannulas or alcohol swabs or whatever you need in inserting an IV. Just the little things that will save you from going back and forth to the patient's room. That will surely save you so much more time in doing other tasks, right? This can also be implemented by streamlining your tasks. For example, at 8 o'clock, the patient called and you went there to answer that call bell. But then, while you go and answer that call bell, you can also do the med pass. You can also give the patient's medication by that time. You can also change their linens if the CNA hasn't done yet. Or you can even do your assessments just so you can do all the things at once so that you won't be going back and forth to the patient's room, wasting some more time in doing other tasks, right? These little things make the biggest difference with regards to your time management. Okay, so the 6th tip is document on time. Always document your tasks on time. This is actually very crucial in your time management as a nurse. Always make every attempt to document in real time. Real-time documentation saves you a lot of time, believe me. Even if you have so many things in mind to do after a task and you think that you cannot even document what you did before going to the next. But believe me, just by documenting on time as you you do it, not just make you go home early, but of course prevent you from forgetting things that you did. As they say, not documented, not done, right? Okay, so the seventh tip I will tell you is avoid non-essential tasks. I think this is the most common reason why nurses sucks on their time management skills. It's not because they have so many things to do for their patient in a 12-hour shift, but what they actually do extra is what they're making them go home so late and cram at the end of the shift. Spending too much with your phone or chit-chatting with your colleagues or just by spending too much in one task. These are the things that can take a lot of your time. Even just subconsciously, you will think that you will just do this in a minute or two, but you ended up spending too much time doing this. That will end you up having more important tasks not done. So just be sure to avoid non-essential tasks on your shift. In that way, you can do more of the more important tasks that are supposed to be done, right? Okay, so the last but not the least tip I will tell you is don't take things too seriously. I mean, of course, we have to be diligent in our job, and everything we should do will be based on our facilities protocols. But I mean, remember, our job is a 24-hour job. All the tasks that we have in our shoulder can sometimes be overwhelming, but always take time to breathe. Take a break. And if you really cannot do all the tasks that you should be doing in your shift, you can always hand over them to the next shift, right? However, that is not our priority. But sometimes, a 12-hour shift is just so overwhelming that you cannot just do really all the tasks that you have to do. If you're already so overwhelmed with all the things you have to do in your 12-hour shift, then take a break. Eat something, drink water or drink something, or perhaps you need to walk away from your unit. Just get that 1 or 2 minute break for you to just recollect your thoughts or get that composure back. Don't ever let yourself be overwhelmed with everything. Always take a break if you need to. We need that as nurses. We have to work, but we also have to take a break at least once in a while during our 12-hour shift, right? Okay, so that's it for my tips you can apply to better your time management skills. I hope you have learned a thing or two on this video. Just know that you get better as you keep on doing these things. Time management is a skill that cannot be learned overnight. Of course, there will always be the next day to be better, right? So thank you very much guys for watching, and if you like this video, please don't forget to hit that like and share button, and again, to those of you who are new here, please don't forget to hit that subscribe button and connect with us. So thank you very much guys for watching, and see you again on my next video. Bye bye.